Good afternoon, all. Thank you, Chairperson. It's always a pleasure to talk in front of, if the Chairperson is one of your mentors. At onset, thank you, ISCCM Hyderabad, for giving me this opportunity to express and share the thoughts. It's always difficult to maintain the energy after this tribute, especially with the eminent speaker coming and expressing their views. This energy itself describes how passionate we are when it comes to the management of our patient. We go all the way, use all the best of the infrastructure. We all use the best of the instruments to save that one life. But in this big energy, are we missing something? Are we harming someone more broader range or more important? And that's the whole talk today is about. What's a green ICU, and we can go as a critical care, go sustainable with that? While the world was very rejoicing over the industrialization and the modernization and what we have, it took a teenager to go into UN and scream at the top of the voice that, guys, just have a bigger picture. Look, what are you doing to the Mother Earth? And that's when the global warming and the term the climate change came in. It was WHO who said that its climate change is actually a health emergency. They found out with all the parameters how everything is interlinked and how this climate change is going to burden on our future of the healthcare and the system. So mitigating a climate change is an urgent challenge for all the healthcare providers. We should feel sometimes proud or a challenge that, okay, when everybody else is doing harm, we are there to take care of it. But in this process, we forget that we are also the part of this world, part of this modernization and the development. How do we contribute to this? Are we contributing to the problem also? Yes, we are. As per the estimation, healthcare sector contributes almost 4 to 5% of the global greenhouse gas emissions. And in the healthcare sector in particular, ICU generates almost 3 times the carbon footprint for a regular inpatient beds. As per one of the study in the Netherlands, they found out that if you're treating one patient per day, it produces almost 17 kilos of solid waste. The energy consumption to the carbon dioxide equivalent production is almost 12 kilos. You use 300 liters of water for that patient per day, and you are using almost 4 meters square of an agricultural land to dump your waste. Now, this is the cost of treating or saving one life, one patient per day. Similarly, an Australian study came up that if you're treating a septic shock patient, you're generating almost 88 of your carbon footprint. And same in United States, it was 178. So the numbers are staggering. This is what we are contributing in damaging the earth while saving one patient. It's very intuitive to think of all the healthcare things which we are doing, how much the contribution is coming from the various sectors. And we would easily think that, yes, the modern instruments, the modern gadgets are contributing a lot. No. As per this one of the US study, they showed that the building, electricity, gas, and infrastructure contribute only 20%. What actually contributing about almost 80% is our clinical care. Now, that's something staggering. how can clinical care contribute to damaging the Mother Earth? They subdivided it that almost 60%, even though we are giving the best of the care and ideal care as per the evidence-based, we are still contributing to the damaging the earth. Rest of the 40% is because of the inappropriate care. So if we want to argue that, oh, we want to give our patient the best, you still have a room of improvement in 40% of the cases. And this 40%, 30% is because of the low quality of the care, unnecessary antibiotics, unnecessary procedures, or actually the wrong care that contributes. And this is all data-driven. So how come the ICU is such a carbon hotspot? A lot is contributed, as you would think, by what we call it as HVAC, that is heating, ventilation, and air conditions. There are various ways we can contribute by going green on that. Most of them also comes from what we call it as a material and supply chain. Every syringe which you use, every material you use comes from the primary source. There is a lot of waste that gets produced, and that waste needs to be recycled, or they do not get destroyed, or they are not biodegradable. And of course, inappropriate ways of using water and pharmaceuticals can add on to the antibiotic resistance. So a global Green ICU movement has begun, and it stands for the greater environmental sustainability in ICU care. It is evident that there are so many journals coming up with the ways where we can improve. It is not only the patient-centric. Sorry. It's gone. Yeah. It's not only the patient-centric, but it also has to be an environmental-centric. And one of the best things which have come about, and so a few of the people like ESICM has come up with a green paper, and ANZAC guys have come up with actually one step ahead with a proper beginner's guide how to do it. In the Green ICU, the goal is to have an evidence-based guide to reduce ICU carbon footprints. And what benefit we get is the reduced environmental impact and the high-quality patient care. Here, the focus is on energy consumption and waste resources. And for that, because it's a multimodal, multidimensional things, we have multiple things which we can do. A 3-step pathway has been given for this Green ICU. The first one is to measure whatever you do in the ICU. You try to measure how much it is contributing for the environmental impact, and then take measures to improve the sustainability. And because this is since in the nascent stage, we need to educate and spread the knowledge. Measuring the ICU environmental impact is easy. You try to find out the environmental footprints and the hotspots, how much energy you use, how much expenditure it is done. There is something called as life cycle analysis. A single syringe which you are using it, a disposable syringe, where it is coming from, where the plastic is coming from, where the needle is coming from, where the metal is coming from. So that life cycle analysis is how you are contributing, how many syringes you are using has got a direct impact. Second, similar to the material flow analysis, which is similar to life cycle analysis. And after we have used all the instruments, materials, we can see where does the disposal occurs. The Green ICU initiative revolves around the 4 Ps of the people, process, planets, and the products. And each of them has a further subdivision where we can go and try to utilize each and every topic and evaluate separately. For example, for optimizing the energy, we can use a personal energy saving checklist like switching to saving bulbs, artificial lights, using appropriate temperature. This was an example. A 10-hour strategy has been strategy of optimization has been proposed, especially for the products and the consumables. Sorry, I will take a couple of more slides. This 10R is, which says that refuse, rethink, reduce while you're admitting the patients. Reuse and repair, which low-income ICUs, which we were already doing it. Either if you're not able to do that, use the refurnished things, remanufacture or repurpose it, or recycle it, and try to recover all the basic material. This has to be with the multidisciplinary, with the Green ICU team, where every person involved in the team needs to follow a specific guidelines and try to commit themselves. And this should happen, these are the principles, and this should happen as a part of your daily routine ICU rounds. And with every ICU round, you need to go with the same principles, not only focusing on your patient, but also to the surrounding infrastructure which you are contributing. Sharing, caring, and empowerment is always there in the team. Empower your nurses, empower your critical care team, empower the pharmacists, therapists, and try to make this team much more stronger. Again, once you have done, the things doesn't stop. The improvement goes on with the audit, education, and try to rebuild the multidisciplinary team. So the take-home message is ICU care should no longer be the only patient-centric. It should be environmental, realistic, responsible, and sustainable. ICU sustainability is a patient safety plus planetary health. Join the Green ICU movement in your ICU. Remember the principles and the pathway. It's not a one-time effort, but a continuous effort. Approach should be multidisciplinary. It's not one person who's going to make a difference. Empowerment and educations are the one to be seen, and work towards zero carbon ICU through teamwork and innovations. With that, thank you very much. For those who are still confused, this is a wonderful, freely downloadable beginner's guide, and it has given very fantastically given how to go ahead stepwise in making your ICU a green ICU. Again, thank you very much.